Hello, and welcome to this discussion of thinking and learning patterns in individuals with high-functioning autism and Asperger's syndrome. My name is Joe Falkner. I'm the autism specialist at Lionsgate Academy. First, a caveat. Any discussion of broad thinking patterns are really generalities. Each individual has their own unique strengths and challenges, and they have their own unique experiences that they've had in learning, both in experiencing learning environments as well as experiencing the adults and the teachers that they've had to interact with over the years. Now, learning is a very complex thing. Learning requires that we take a number of things into account really all at the same time. And most of these things aren't things that are directly taught to us. We have to take into account the social nature of the classroom. And classrooms are really set up on a social hierarchy. Somebody decides on what the structure is. One person is the teacher, the others are the individuals are the students, and they really set up along social rules and social roles. Now, there are some broad cognitive patterns that have been identified during studies over the years. I want to focus first on the left-hand side of this slide. And on the left-hand slide, I specifically want to address the last point, which is sequential and analytic processing. Because this is really a strength area for many individuals with autism, is this ability to be detail-focused, to find the facts and the individual parts of something. This again is a strength area for individuals with autism. Now, on the right-hand side, what we see is the areas that individuals with autism struggle more with are those areas that tend to require more integration of information. They require more parts of the brain working really smoothly in synchrony and harmony with one another. And so on the right-hand side, these are the ones that really require us to do more than just use our basic language system. Now, there are many theories of autism. One theory of autism, these three theories of autism are pretty common in the literature. The first one is theory of mind. And theory of mind really gets into this concept of how do we understand others? And how do we understand others as being different than kind of who we are? So how do we know their thoughts and their feelings? And how do we appreciate them? Theory of mind really refers to these two things. And these two things are really this capacity to recognize others, thoughts, feelings, and these we put into a broad concept called mental states. And in a couple minutes we'll talk about some specific mental states. But key amongst these mental states really are this concept that others have intentions, thoughts, and feelings. The second part of this, though, is that they use these, or we use these, to predict the behavior of other people. So it's not just that we are able to think about others, but we're also use it to be able to predict what they're going to do in the future. Now, there are a number of different mental states, as I just said. And I'm going to go over a couple of them right now. One of them, and we do this so naturally we're not even aware of it, is called purpose of intention, or we look at what people do and we develop a purpose for it, or we say this is why they're doing what they're doing. This is what they're intending to mean to me when they do this thing. And we do this again so naturally that we don't really think about it as we're doing it. Another one, and this is one that we frequently use. In fact, this will tie in later also to some executive functioning skills, is thinking. And thinking is a really active process for us. And as we think about things, we're actually also reflecting on our thinking, and we're we're thinking about our thinking, and we're thinking, what right now am I really kind of meaning when I'm saying this? And so we're able to check ourselves, and this is a really important skill in school for a number of different reasons. One, it's something that stops me from saying things in class that I may not really want to say. So if I think about it before I say it, so I go, do I really want to say this? It also allows us to reflect on stories that we're telling. And as we're telling the story, we can look at it and go, do I really want to say this in this story? Is this really true? Did it really happen this way? So the ability to both think and think about our thinking are really important skills, and there's skills that the individual with autism does struggle with. Now, a third one I'm just going to point out, and that is a concept of deceit. And deceit is something that we often see as really bad. If someone tries to deceive us, we often think that this is not a good skill. And yet, this is a very important skill for individuals in social interactions, and it's an important skill in actually testing people's theories of mind. In fact, one of the common tests of theories of mind is called the Sally-Ann test. And it's all about Sally having a marble and putting it in a box, her leaving the room, and Ann taking the marble out of the box and putting it in a bag. Ann then leaves the room, and Sally enters the room. The question is where does Sally believe that the marble is? In the box or in the bag? For individuals with a well-developed theory of mind, we're going to think the box because that's where Sally left it. For individuals who struggle some with theory of mind, they are going to think it's in the bag because they know that that's where Ann put it. And again, they don't get that Ann was deceiving Sally by moving it from the box to the bag. Theory of mind is also known as a number of other things, and these are all things that show up somewhere in the literature. A couple of them are a little bit more common. The concept of mind reading and perspective taking. These two concepts show up a lot in the autism literature. And mind reading isn't this kind of psychic thing that we do, but it's really our ability to take a number of things into account. So we take into account what we see on the person's face, what we hear from the person, what we know about the context of the situation, and we use all of these to make a prediction about what another person is thinking, feeling, believing, etc. Okay, so theory of mind and ASD. What we're looking at here is that individuals with ASD, to some degree, may have struggles with predicting others' thoughts, feelings, and ideas. They also might have difficulty with appreciating or valuing them. And this is a little different. A person may be able to say, I know this is what you may be thinking, but they may not value your thoughts and feelings and ideas. They may feel that theirs are better, stronger, etc. That can be another aspect of a theory of mind problem. Because again, we're not necessarily reading the whole situation to understand that sometimes I may need to put away my own thoughts and feelings and ideas to be able to honor yours. Now, a second theory of that's around autism is called central coherence. And central coherence is the ability of an individual to really see a coherent whole, or to get the gist of something. And as we said earlier, when we looked at some broad cognitive patterns, individuals with autism are very good at finding details or finding the small pieces. There is a tendency for some individuals to have more difficulty finding holes. But this can be a strength area. The ability to find details can be a strength area in certain tasks and actually in certain jobs. I think of the ability to read long series of code for computer programming. And that really requires somebody to be very, very detail oriented and to be able to figure out or piece out what might be missing or what might be wrong. Now, individuals with ASD who have some struggles in this might have some difficulties sometimes just picking up irrelevant or unimportant information. They may have difficulty actually figuring out what are they supposed to be focusing on. What in all of this information, whether it be reading, so what in all of this text are they supposed to be focusing on? Or lecture, if somebody's talking to them, what are they supposed to be listening to and what are they supposed to be listening for? They may pick it out as just a series of details rather than getting the whole or the meaning of what somebody is saying. A third theory around autism gets into the executive function system. And when we look at the executive function system, this is our kind of command and control center. This is the thing that really guides us or tells us exactly what we need to be doing to be able to complete tasks. So when we look at this, this particular breakdown really looks at three broad areas, which are organization, regulation, and awareness. And I like this breakdown because this gets into some of the areas that individuals with autism may have some struggles with. Now, for general learning, it's really important that we remember this is a very dynamic process. The learning requires that we're really paying attention, and that we're not just paying attention to detail or the thing that's going on right in front of me, but we're really taking our whole environment into account. It also means that I need to control irrelevant or behaviors that I want to come out right now. I need to be able to control them and put myself in a place where I'm able to stop myself and focus on what somebody is saying. I also have to figure out that something that I learned in one area is something I need to generalize over to other areas. And this can be a struggle for some individuals with autism because at times we'll give a direction to the whole class, and we'll expect that the whole class will follow that direction. And the individual with autism might struggle at times taking that into account and really modifying their own behavior based on what you're telling the whole class.